In most situations, there's no single right decision when it comes to your healthcare. Choices about medical tests, procedures, and treatment plans are based on your unique situation. That said, there are things you can do to help improve or maintain your health. And when you need care, you can find quality, affordable healthcare from the right care provider at the right time and at the right place. We know that some things are out of our control. We get sick and accidents happen, but maintaining a healthy lifestyle is still one of the best ways to improve your health and control healthcare costs. And with the fast pace and increasing demands of balancing a busy work and home life, that's often easier said than done. Stay healthy. Use preventative care when you can. Here are a few helpful tips for your muscles and mindset to guide you down a path to better health. Stay active. Exercise regularly. Eat regular, balanced meals and stay hydrated. Make sleep a priority. Limit alcohol use. Set goals and priorities. Try a relaxing activity. Practice gratitude. Stay connected. Improving or maintaining good health also involves establishing care with a primary care provider who can help you reach your health and well-being goals. 85 to 90% of any care you'll ever need in your lifetime can be delivered by a primary care provider. Primary care providers and specialists that work for hospitals are often evaluated or financially incentivized on measures that are not based on healthcare quality. Measures such as patient volume, visit time, referrals they make to higher cost specialists, kickbacks from pharmaceutical companies, or incentives based on expensive tests ordered through the hospital. Oftentimes, these expensive tests could be performed at a lower cost facility. There will be times, whether during routine preventative checkups or following an accident or presenting symptoms, your doctor may suggest additional medical tests or imaging. Reduce your medical test costs. Ask questions. Before you agree to expensive medical tests, understand how they will help you. No test can be done without your permission. Ask your provider how the benefits of the tests outweigh the risks. Ask your provider what the cost is and evaluate how your plan will cover the test. For your illness or medical condition, your doctor may also prescribe medications. Ask your provider questions about any prescribed medication. Ask your provider to send your prescription to the pharmacy of your choice. Don't expect a prescription for every illness. Sometimes, over-the-counter remedies are all you'll need. If you're prescribed a medication, ask about generic alternatives or low-cost name-brand options. If you are referred to a specialist, a little preparation and communication can help ensure you are using these higher-cost specialists wisely. Before you go to a specialist, you should always take these steps. Know the diagnosis or suspected diagnosis. Know the goal for seeing the specialist. That is, are they taking over your case, confirming your diagnosis, or conducting additional tests? Before you agree to see a specialist, good consumer skills can improve your quality of care as well as financial and physical health. Consult with a Kempton Care advocate about your treatment plan and consider all possible options. The team approach to medical care is the best approach. The choice you make needs to be right for you. If you require a procedure such as diagnostic testing, lab work, or even surgery, pause and consider a referral to a KPP-free provider for your care. The cost for procedures can often exceed that which you budgeted, and there's nothing you can do about that after the fact. KPP-free is an enhanced benefit where patients can receive quality medical care at no cost to them. In addition to primary care and specialists, there may be times when you need to access emergency services. In life-threatening situations, modern emergency services are a critical place of care. For routine services or procedures, they are not. Emergency care settings often overcharge 2 to 3 times or more than a primary care practice or urgent care. Identify providers and urgent care facilities in your area with extended hours on nights and weekends to use as alternatives to emergency rooms. Be confident about your plan. Let your provider know your employer pays your medical claims through a self-funded health plan and that cost matters to you. Make sure your provider has an updated copy of your member ID card. The member ID card contains important claims filing details for your provider. When you get a bill, match it to your explanation of benefits. The explanation of benefits will explain your benefits and your patient responsibility. Ask your provider for itemized bills. Question charges you believe are incorrect or you don't understand. Contact your Kempton Care advocates if you have any questions. The best health and financial outcomes occur when patients are educated, engaged, empowered, and effective. As always, if you have any questions or wish to learn more about your benefits, contact Kempton Care Advocates at 800-324-9396.